What I will be doing is I will present the PowerPoint presentation. Maybe
Okay.
I should be able to complete in 15-20 minutes. So last 10 minutes,
Right.
question and answers.
Take a talk. Okay, excellent, excellent. So whatever you're comfortable, we'll start our very special talk today. And welcome all the participants for this special talk today, including our Cerimed members. And we are very fortunate to have today very special person, Dr. Dayadhipananda ji. Is a He's a doctor. At the same time, he's part of our Ramakrishna missions, one of the hospital from Haridwar, and he has extensive experience on handling yoga and integrated approach of handling various diseases. So he will be talking on the management of diabetic mellitus with the treatment of through the yoga treatment. So I think with this just very few words, I will hand over first to Anirban. If he wants to add little, can you share? You can tell little background of Dr. Dayadhipananda ji to the other audience who are joining first time. Anirban, please.
Yeah. So, very briefly, I would hand it over to Dr. Dayadhipananda to give a small brief about himself. So, today's talk is about diabetes mellitus and how yoga's intervention is going to, his experience is going to share with all of us. Dr. Dayadhipananda ji is the head of the institution of Ramakrishna Mission Hospital in Haridwar, and he is a Cerimed member. And today's session, we have requested him last time whether he would be in a position to take it. So I'm just muting everybody. So there was some background noise coming from some other participant. So with these few words, I'm handing over to Dr. Dayadhipananda ji. Sir, over to you. I'm making you the spotlight, and I have also put the recording so that we can use this recording later on.
You have to make the
Over to
speaker
you,
unmute.
Dr. Dayadhipananda.
Namaskar. Good evening to all. My respectful namaskars to all the Cerimed members. Also, some specially invited people who are there to attend this talk. I have my few known doctors who are already working with me with the concept of integrated medicine. In the first 15 to 20 minutes, I'll go with the PowerPoint presentation, where I'll be speaking mainly with the pictures of our hospital and children with type 1 diabetes who are already practicing integrated medicine. So now I'm going to share my screen. So,
You're able to share the screen, sir?
yeah, I'm doing it now. So, hope you are able to see my screen.
Yes.
Yeah.
Yes, sir.
Right. So, okay. So this is the topic for our discussion today, role of yoga in diabetes mellitus. So by the word yoga, here I will restrict myself for asanas and pranayama. People who have little background about Indian philosophy, if some of us have studied Ashtanga Yoga Sutras by Patanjali Maharshi, will understand he has 8 steps in his explanation of Yoga Sutras. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So when I say yoga, ideally, it should address all the 8 steps as explained by Maharshi Patanjali. Here we shall restrict ourselves for yogasana and pranayama. This is the place where I work. Ramakrishna Mission Sevashrama, Haridwar is a 200-bedded charitable hospital founded in the year 1901 by the direct disciple of Swami Vivekananda. This hospital started to work when Swami Vivekananda was alive. With the blessings of the monks, saints, and God himself, now this hospital has emerged into a 200-bedded multi-speciality hospital which works around the clock. This is a very special picture which you can find. Ramakrishna Mission Sevashrama, Kankal Haridwar observes World Diabetes Day. Children with type 1 diabetes celebrating their disease. Every year, on the occasion of World Diabetes Day, the Sevashrama conducts various programs, including few cultural programs by the type 1 diabetic children themselves. Coming to the proper topic, diabetes. Why I am addressing only on diabetes? Because short of time, if this module of integrated medicine can be applied to one specialty, it can also be very well applied to many other specialties. So I shall restrict myself to one topic, that is diabetes. As we all know, diabetes mellitus is a chronic preventable lifestyle disorder characterized by increased blood sugars. When we classify diabetes into type 1 diabetes, type 2 diabetes, gestational diabetes, and secondary diabetes, the purpose is to find out some preventable causes in all those categorized diabetes. In type 1 diabetes, body is not producing insulin. One has to take insulin lifelong. Type 2 diabetes can be managed with oral hypoglycemic agents, and with proper diet and exercise, even one may go off this OHS in the beginning when one is with borderline diabetes. In advanced cases, depending on the disease, one may have to go and take insulin. Gestational diabetes seen in mothers, usually, ideally, the mother should be put on insulin for healthy mother and child. Comes to secondary diabetes, if the diabetes is due to some underlying diseases, that has to be treated. Understanding the pathophysiology, understanding the preventable causes help us to address the issue more properly. What are the preventable causes? When I say it's a lifestyle disorder, whatever the disorder that we are seeing in a patient mainly presents with central obesity, and stress is often seen one of the major causes for diabetes. The main point which we make out in all diabetic patients is the insulin resistance. The more the insulin resistance, the more the patient is going to have complicated. So understanding these preventable causes, in brief, the lifestyle disorder, can we seek something else other than just medicine? That's where role of yoga, integrated medicine, holistic medicine, alternative medicine, many terms which we may use, come into role. Can diabetes be controlled with exercise and yoga? Yes. Before we go ahead and talk about the advantages of exercise and yoga, let me understand what actually this human body, what we call as body-mind complex. All our great teachers, all the great teachers of the world religion have experienced something, and that they have proclaimed to the world. When we read our scriptures, Upanishad, Bhagavad Gita, we very well understand we are not just this body and mind, but something beyond this body and mind. And because of that, this whole universe and our own body runs. We may call it as Atman, Brahman, Ishwar, Bhagwan, a Jesus, a Buddha, a Allah, whatever the name that may be. So some people who don't believe in this religious concept can go ahead and think that we are that highest energy which can be neither created nor destroyed. We are that. That energy which runs this universe runs our body and mind too. So when we know this, when we practice some spiritual disciplines and realize our own self, which we call as self-realization or God realization. When you experience your real nature, that is called as Anandamaya Kosha. Satchidananda Shivoham, what we call. Actually, in reality, we are bliss itself. So when we experience our real nature, we go beyond the suffering of all this world. For that, we have to understand Vijnanamaya Kosha. After experiencing what is right, what is wrong, what is eternally there, and which is my real nature. That is Vijnanamaya Kosha. To understand Vijnanamaya Kosha, we should understand there is mind behind this Manomaya Kosha. So this Manomaya Kosha can be understood when we go and learn about Annamaya Kosha and Pranamaya Kosha. Annamaya Kosha is nothing but the physical body about which we all medical practitioners, maybe allopath, a Siddha, a Ayurveda, a Unani, we all may speak. We are mainly focusing on how to take care of this physical body, how to prevent the diseases that we see in this physical body. And as a psychiatrist, when you ask them, they are more worried about the mind, state of the mind behind it. And whenever there is imbalance between the body and mind, that may present with many of the diseases. The Pranamaya Kosha is the one which runs this body, Prana Shakti, the vital energy. So it's very important to understand we are not this just physical body, Annamaya Kosha, but the Pranamaya Kosha runs this Annamaya Kosha. Behind that, Manomaya Kosha. Behind that, Vijnanamaya Kosha, which is our real nature. And Anandamaya Kosha is the cause to run this body. And the universal energy is responsible for running this whole universe and our own body itself. Understanding this in brief, understanding that there is something called body-mind connection. Sharira madhyam kaludharma sadhanam, what Shastras have said. This body has to be used for realizing our real nature. Body and mind is connected. If you are not keeping well, you will not be able to read properly, think properly, that everybody might have experienced. So where there is a strong body, there is a strong mind. They are interconnected. Coming to some of the treatment aspects to take care of this, our Pancha Koshas, Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha, we advise few things. To take care of this body, to keep this body fit, one has to practice some asanas, yogasanas, right from Surya Namaskara to various asanas which can be practiced. Pranamaya Kosha, to take care of the Pranamaya Kosha, we should have proper breathing exercises by which our prana shakti, vital energy, is distributed evenly in every cell of the body. Manomaya Kosha. To take care of the Manomaya Kosha, one has to practice meditation, relaxation techniques, some mudras. Vijnanamaya Kosha, understanding our real nature, what I am really, which is the energy, which is the thing that runs this body and mind, that can be had by understanding the message of our Upanishad and great teachings of saints and great spiritual leaders. One can understand that Vijnanamaya Kosha, which is our real nature, and that comes from our real Swarupa, Anandamaya Kosha. Anandamaya Kosha can be attained by doing Karma Yoga, selfless service to mankind, and by practicing Ashtanga Yoga Sutra, Yama Niyama. What to do, what not to do. Asana, Pranayama, some sort of physical postures and pranayamas. And Pratyahara Dharana. Pratyahara, to be away from all that is an hindrance to our good life. And Dharana, understanding the great heritage, the great culture, and having the right knowledge. That is Dharana. When you are constantly thinking, when you are constantly focusing on positive things, you reach that state of dhyana, meditation, and one who reaches ideal state of dhyana attains samadhi. The Jivatman becoming one with Paramatman, which is the goal of life, God realization. Now coming to the role of yogas in managing diabetes with this philosophical background, we can say yogasana and pranayama have definite role. And as said in the beginning, central obesity due to lifestyle disorder, the decrease, the insulin resistance where it is increased, that is the root cause for all the disease that I am seeing in diabetes. So yogasanas, if practiced properly, reduce central obesity, thereby decreasing the insulin resistance. Lot of research has been done on this. So many asanas taught by different traditional teachers, when practiced properly, definitely yogasana help in reducing the central obesity. These are the few postures, few forward bending and backward bending postures that we advise to reduce the central obesity. I was telling in the beginning, my focus will be more what our children are doing here. So type 1 diabetic children, every month in the support group meeting, they start their meeting with a prayer. After prayer, they practice yogasana and pranayama. This is type 1 diabetic girl. When she came to me, she was 4-year-old. Now she's 10-year-old, practicing regular yogasana and pranayama. And now she has become very famous in the school and she participates in district level. Type 1 diabetes could not stop her achieving all that she wanted, provided right treatment and right support. We also conduct some summer camps where we teach them yogasana and pranayama. Pranayama helps in regulating the breathing pattern, thereby relieves the stress. In the beginning, I said stress has become one of the major causes of diabetes mellitus nowadays. Pranayamas like Anulom Kulom, Kapalbhati, Vastrika, Ujjayi Pranayama, Omkara, they have definitive role in reducing the stress, thereby definitive treatment for diabetes mellitus. So when we say health, when we say disease-free state, as very well defined by WHO, physical, mental, social and spiritual well-being of a person, and not just mere free from disease. So our Shastra, our scriptures has said the highest state of happiness, Ananda, is our real nature. So that is the highest health one can experience, the state of Ananda. That can be attained by meditation, prayer, and yoga. So we also regularly practice yogasana and pranayama, meditation and prayer. And see, our children also practice in the support group meeting all these spiritual practice. Along with that, we give them diabetes self-management education, DSME. Our type 1 diabetic children, they know everything about type 1 diabetes. They're able to take their own insulin. They're able to make their own decisions, how much insulin I should take. So with this proper knowledge, right from physical to spiritual strength, they can overcome hardships in life, they can take healthy decisions, and they can live longer. Again, little bit of spirituality saves one from great danger, as Sri Krishna said. Swami Vivekananda in the modern times also said, strength is life, weakness is death. So our purpose of being healthy should be individually well-being, helping others in making a good society. The basis of this depends on renunciation and service. Not for me, but for others. Not for me, but others. That is the motto of Ramakrishna Mutt and Mission, started by Swami Vivekananda in the name of his Gurudev, Sri Ramakrishna Paramahamsa, where we have more than 200 centers in India and outside India. Everywhere, the ashrama works based on these two principles, renunciation and service. This is the picture of our type 1 diabetic children and family who are staying fit and healthy, being type 1 diabetic. They are leading a wonderful, exemplary life. This is a small picture of Swami Vivekananda Ghat on the bank of Swami Vivekananda. We have a beautiful campus of 18 acres and serving the poor and needy. So with this brief note, a brief introduction, now I'm going to unshare my screen. Though I try to cover whatever possible in the 15-20 minutes, it was a huge topic where I tried to cover with the examples of children doing it. By the word yoga, we should not restrict ourselves to just some few asanas and pranayama. It is up to meditation and samadhi. So this is what integrated means for me. And this is what we are practicing in Ramakrishna Mission Haridwar. More than 300 type 1 diabetic children living a happy and normal life. And they are proud that they have got type 1 diabetes. Type 1 diabetes, blessings in disguise. That's what they say on the stage whenever we celebrate World Diabetes Day. So everybody can contribute to the society for the well-being of the society, for the individual well-being, and for the social well-being. We should have spiritual health. That's what integrated medicine means for me. If any one of you are interested to talk to my diabetic child who is doing her MSc and who has been having type 1 diabetes for more than 15 years and is a role model for everybody. And there is contribution from various people, endocrinologists from India, from London, from UK, from America, and everywhere, and consultants of this Sevashrama. Everybody has contributed. Dietitians like Gauri from Bangalore, doctors from America like Sushil, who are there in this group, Dr. Naveen, who is an orthopedic surgeon. They are all helping these children to lead a happy and normal life. This is what integrated medicine means for me. Now I stop here I'll be very happy to take questions if anybody wants to have some questions. Also, if somebody is interested to listen to Surbi, I can invite her also. Anirban, it's now for you.
Yeah, thank you, Swamiji, for your excellent presentation. And I have given the permission for people to unmute. You can unmute and you can ask the questions, because some people have posted questions in the chat box. In case
I can put
Dr.
the
Vikas,
question.
you have made a comment. Would you like to unmute and ask Dr. Swamiji about your question?
No, I don't have to ask anything. I am just listener today.
Fine. So,
But
Okay.
I appreciate the efforts of Swamiji. I suggest that he should give the data of particularly type 1 diabetes patient children who are getting the relief by yoga and pranayama, and publish that data so that it can increase the confidence of medical fraternity as well as patients.
Thank
Because
you for your kind note. We are working with Yasvyasa and Patanjali. We have taken up some research project. For example, Surbi, there with me, she used to take 60 units per day insulin. Before she used to do all this. Now she is practicing all this, and her insulin requirement per day has come down to 30 units per day. And above all, they are leading a happy and normal life. That's where I said we have created a special support group meeting in which we take care of their physical health, their mental health, social, emotional, and spiritual health. Based on this, and that should be a continuous support. So, for me, integrated medicine means every month, once in a month, group of patients in one group should be meeting once in a month and learning and sharing with each other. That's where it helps them to become emotionally strong. Yes, we are presenting our research study. Yes, Vyasa and Patanjali both are have taken up a research project. Thank you.
excellent, Swamiji. Thank you.
So this data is available, Swamiji, in any forum for the public? You mentioned about the research project.
Still, we have not published. We have taken up a research project. We should be able to publish maybe under 6 months.
Okay, okay. So that will be very nice. In case we are now just coming up with Cerimed website. Probably some of these information could be there, which could actually become the highlight in terms of the way in which, probably those could become the platforms going forward, where we could publish and we could take forward those data which is emanating from this great work which you have been doing for last so many years. So that needs to go down, that needs to percolate with people. So anyone else? I think we have.
Yeah.
Yes.
Yeah.
Yes, please.
Okay.
Anjali, yes.
Yeah, I am
Okay.
Manjari from Lucknow. Swamiji, Om. I just wanted to understand, Swamiji, whether अभी आपने share किया कि like doing services for others, not for me but for others. So do we have some data also available for this? First, on reducing the symptoms of type 1 diabetes, plus people who are pre-diabetic or may have a tendency of being diabetic, जिनकी genetic history होती है, उनके लिए if they are continuously into social services, उसके लिए भी कोई data है क्या which proves or which supports, not proves, that will keep them away from diabetes? These are two questions. First, for people who are already diabetic. Second, for people who are not diabetic but having tendency. ये दोनों के लिए कोई data है क्या? Because when we talk like this, there is a big class of people who immediately start bombarding questions over us. So I would be really delighted to know that.
You're right. As such, we don't have major research studies on this, but studies have been started in Harvard and all those things. Dr. Sushil should be able to tell more about this in his next talk, especially the volunteerism, which we will be focusing on his next week talk, Dr. Sushil Sharma. He should be able to give you more of those research and things being done in USA.
Okay, thank you, Dr. Dayadhipananda ji. I have one small query. It's about, I remember one of the talk I was listening from Dr. Tuli in this same forum. He also admitted that yes, this works wonderfully, but it takes some period of time to level up understanding, then practicing. So what's your experience? How long or how many weeks or months people really get to do it to get some level of confidence or the expectations or whatever they're seeing they're benefiting them when they realize that?
Yeah, very good question. When it comes to helping somebody and bringing some new practice, it all starts from the physical level. So when a patient comes to me in diabetic ketoacidosis, I treat him, the child is normal, both child, parents are very happy and they want to follow whatever I tell now. So right from the beginning, we should give them a whole idea about diabetes self-management education. Once you've done that, then you have to help them mentally, you have to help them emotionally, you have to help them spiritually. That is the only way. And it's a continuous and dynamic process. Today I taught them, tomorrow they'll be doing, no, it will not happen. It's continuous. So if you're treating a lifelong disorder, you have to motivate them, guide them, support them lifelong. That's where the role of a support group making. If it is an acute disease, just explain them, and if they can pick up, it's very good. So to bring in the behavioral change, one need to work at the mental level. Manoyo. Dr. Sushil Sharma will be speaking more about all these things in his next talk. So maybe this is just an introductory talk based on our work that we are doing today. I have given. Dr. Sushil should be explaining all those things in the next talk. Yeah.
Maybe a couple of words from Dr. Sushil. Dr. Sushil?
Yeah, Manjari raised a question about volunteering and altruism and the benefits on health. There is extensive data actually published, and there is demographic data, there is epidemiologic data. For example, they looked at the incidence of the heart disease and heart attack and death and cardiovascular disease in the USA, and they plotted that against all the 50 states in the USA. And they also plotted how many states have faith-based activities. In other words, how many states have more people going to church and being religious and volunteering. Because volunteerism and service is a very big concept in Christianity, as you know. And they found out that the states that have the highest number of people that are faith-based and volunteering had the lowest incidence of heart attack and stroke. So this was not a fortuitous finding. Then they prospectively also studied and looked at several different groups of people in terms of how much altruistic or volunteering activity they do and the incidence of heart disease. And there's a clear correlation. In fact, they have come up with a recommendation that optimal volunteering activity is 2 hours a week. If 2 hours a week minimum, you do something which is not self-centric, but other-centric and is making a difference in the life of people around you for which you're not being compensated directly or indirectly, that has profound effect on your well-being. And there is a 15 to 20 to 25% reduction in heart attacks in those people that follow this path. They also found out that 20% of people, 1 in 5 person that gets a heart attack actually has depression. And the strongest thing that can actually help you with the reactive depression, I'm not talking about endogenous depression, which is a different disease state, is volunteering. So there is a correlation between volunteerism and blood pressure, volunteerism and heart attack, and volunteerism and longevity, other than physical and mental and spiritual well-being. So this is something that we can talk about. I have a slide that I'll put on the Cerimed, which has actual studies that have been done with the reference and publications. And I'll try and do that tomorrow for everybody. And if Manjari's email is on that, you can forward her also.
Sure, we would love to do that. Manjari, your email must be there with us, so we will send it across what Dr. Sushil shares.
I'll be sharing. I'll be sharing that soon.
Okay.
Thank you.
Fantastic.
Thank you so much.
Yeah.
Thank you.
So,
But again, I don't have any specific data on diabetes. This is on cardiovascular medicine. That's the data that I.
That's just so fine. That's just so.
So, any further question we have from anyone coming across from the group?
I have got two important people whom I invited personally. One is Dr. Naveen Agrohi, he is an orthopedic surgeon, who is a man practices integrated medicine. And we have one more person, Dr. Chandrasekhar Kelgar, who is an ophthalmologist, who is also practicing integrated medicine in his own ways. Chandrasekhar Kelgar is from Karnataka, Ranebinno. Naveen Agrohi is from Haridwar, Turkey. So he is our honorary consultant orthopedic surgeon. Once in a week, he comes as honorary visiting orthopedic surgeon at our Sevashrama. He has his own nursing home in Turkey. So these are the two doctors especially present. I wanted to introduce them to Cerimed. I'll also provide their email. You can also write an email.
Sure.
Hello, Dr. Naveen.
Hello, sir. Namaskar, sir.
So, Dr. Naveen's a lot of good quality Swamiji mentioned, but there is another one that I enjoyed is that Naveen also owns a strawberry farm. So we have beautiful fresh strawberries when I was in Haridwar in his farm, and that was a beautiful picnic we had. Thank you.
Thank you, sir. Thank you, sir. Thank you for remembering.
More than anything else, probably we'll remember you for your strawberries, Dr. Naveen, going forward. Yeah.
I got my two children present, Surbi and Prakriti. Prakriti is a very good yoga expert and she's a role model girl. And she is studying Prakriti. Just tell about yourself in 1 minute, Prakriti.
Hello everyone.
Hi.
My name is Prakriti and I am in class 9th and I am 14 years old. I am diabetic from last 8 years.
Okay.
What's your routine?
First, I do yoga, 1 hour yoga in the morning, and in the evening, I do 1 hour yoga from 6 to 7.
Okay.
Then
Food.
Then about your breakfast, lunch, dinner.
You have become muted, Prakriti.
Prakriti, unmute.
Yeah, I've asked her. I think a
Surbi.
signal has got a bit of an issue.
Surbi.
Good evening, everyone. Myself, Surbi Chaudhary. I'm type 1 diabetic for the last 14 years, and I'm doing masters in zoology from Haridwar only. For the past 14 years, I'm taking treatment from Ramakrishna Mission, and I've learned a lot from Ramakrishna Mission, not only related to diabetes, but related to so many things which I can practice in my life, and which can help me out in making my future better. And Maharaj has helped me a lot in this journey. So first of all, I would like to share about my routine. So I daily practice yoga. I take proper diet. When I was diagnosed with diabetes, I did not start exercise at that time, but when I realized that it is good for me, Maharajji insisted me to go for it. So I started doing yoga, and I also do Zumba. So it helped me a lot. Like I used to take Besilog, 24 units earlier, and now it has reduced to 14. So there's a huge difference between 24 and 14. And my blood sugars are always in level. My HbA1c is 6.8%. So as this webinar is basically on integrated medicine, so I would like to share that I also take Ayurvedic medicines, not medicines properly, like aloe vera juice, like tulsi herbs, side by side along with.
Ahara Paddhati.
So this has helped me a lot with my diabetes. So Like, I just want to share that the secret of getting ahead is getting started. So the ones who are not doing exercise or yoga should definitely start doing it. It's really good for all of us. And if we need a healthy body, then we should work for it. Thank you so much.
Oh, excellent, Prakriti. I learned something. So, secret of getting ahead is getting started. That's excellent.
Exactly.
Anything else? Anything else we have from anyone? I think we should allow uh, the other lady to finish. Prakriti, Surbi, I think. Thank you very much. Prakriti, you were there.
Kriti,
I can see her.
Kriti is there. Prakriti has
Yes,
come back.
yes, sir.
हाँ
Yes.
प्रकृति अपना खाने के बारे में अपना रूटीन हाउ यू आर एंजॉयिंग टाइप 1 डायबिटीज उसके बारे में थोड़ा बताओ.
I'm very happy with that I am diabetic. Not so frustrated about this, and I daily practice yoga, and I also eat healthy diet. And my best one day I got 52 units total, regular and basal log. Now I'd get 42 units in one day.
Okay.
So your insulin requirement has come down. So how
Yes.
about your healthy diet? Healthy diet के बारे में बताओ.
In healthy diet, I usually eat salads and chickpeas because they are good in proteins, and
Fruits,
less carbohydrates.
fruits.
And around midday I eat fruits. I like basically like papaya. It's my favorite fruit.
Fantastic.
Thank you.
So very nice, Prakriti. Nice hearing from you. Good that you could join us today.
Thank you,
So,
sir.
anything specific from you, Dr. Subrato? Dr. Subrato is not
No,
there.
at this stage, I think it is a very interesting to hear not only from the practitioners and Swamiji, but everything is much more make confidence. We are thinking about that data. Some of us actually scientific mind always looks for a data, but when you hear from the patients, there is nothing like it. So that's what we experienced today, and I'm very very fortunate and thrilled to hear this kind of presentations, which make the much more understandable and believable. I mean, it's always we know this works, but when it, which way you can tell others? I mean, this is, we know everybody understands science, but when you hear from both the sides, the person who is treating and the person who is receiving, both are in agreement and seeing the benefits. I think we should try to promote, and it's a very, I'm very, very thankful for Dr. Dayadhipananda ji for making this way of presentations, at the same time bringing some of the actual patients and making their case to know and have a better understanding of the whole philosophy and the lifestyle and the traditions, which is very much our ancient wisdom. We know it's exist, but we forgot because of so many other things. So I'm very happy to hear today. So that's my comment, and thank you again to all of you.
I call them as diabetic champions because they have defeated diabetes.
Yes.
So they are our diabetic champions, champs in short.
Fantastic.
They are no more patients because they have got a lot of patience to learn and practice.
Fantastic.
So they are our diabetic champions, champs.
So, yeah. Thank you so much for the wonderful talk and very enlightening and very enriching, Swamiji. I'm Dr. Shweta, by the way. I practice in Hyderabad. I'm a pediatric nephrologist. And I mean, I've heard of this concept and now I would like to, explore it further. They say that science and spirituality at a certain level, when at the pinnacle of the level, they kind of merge. So probably that's where your talk has led me to probably, explore that zone where science and spirituality probably meet, and then that's where the immense benefit to the patient and to one own individual self also sets in. So thank you so much for the wonderful talk today.
Thank you for your kind words, and we would love to be in touch with you. I would also invite you to a support group meeting.
Your voice is breaking. Hello? Yeah?
I was just telling you that I'm so happy to learn about you. You're a pediatric nephrologist practicing in Hyderabad. We will be inviting
yes, sir.
group meeting in our future.
That would be a privilege and an honor, Swamiji. That would really be an honor. And because even I deal with lots of chronic patients, and then beyond the point, apart from extending your, whatever that you are with the patients mentally and spiritually.
Yes.
Beyond that, I think that's also a big thing that we can offer to the patients at this point.
That's what I wanted to share in brief with all the medical practitioners here, that we should have a regular monthly support group meeting.
Definitely.
And especially the chronic diseases like CKD, you must have a support.
Yes. I mean, ultimately, all my chronic patients, they progress to CKD, and it's so disheartening to see these 10-year-olds and 12 years old progressing towards that. And not everyone can afford a transplant or would want to go for a transplant. So
what's important is the quality of life that we live.
Yes.
So if we can add to the quality of life, that would be the greatest service, and that's where we'll get a lot of joy.
Right, sir.
Definitely will invite you to our support group meeting. You can definitely pick up a few ideas and you can support.
That would be wonderful.
Side, definitely we will be able to help you.
Totally appreciate, Swamiji. I'll just keep this in perspective. I mean, it has been a very nice session today. Thank you so much. Thank you.
Thank you, Dr. Shweta, for your nice comments and the responses from Dr. Dayadhipananda. If we don't have any further questions, it is already 7:20, close to that, 2 minutes to 7:20, 7:18 to be precise, Indian clock. Dr. Subrata, with your permission, can we close the session?
Yes, please go ahead and you do the final closing today, please.
Okay, so thank you everybody for the fantastic participation and wholehearted support to Dr. Dayadhipananda for the excellent work what he's doing. We do really look forward to this budding group, this nascent group, this the vibrant group of Cerimed, going from one step to another in very short period in time. And I'm sure with each one of your such fantastic participation, I'm sure we are going to see a lot of good things happen to the people who are a participant to this group, to the community at large, and particularly for the people who will get benefited out of this initiative. So with these few words, thank you everybody for one more time, and look forward to further enlightening sessions for in the next subsequent meetings of Cerimed. Once again, thank you, Dr. Dayadhipananda, for an excellent session today. Thank you very much.